Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And this is your show, as I always tell you, and there have been a lot of questions relative to the issues of rheumatoid arthritis and autoimmune diseases. And we're going to find out what that's all about. So in front of me is Dr. Marc Kesselman. He's the director of the Division of Rheumatology and assistant professor here in the Department of Internal Medicine at the Kiran C. Patel College of Osteopathic Medicine. Welcome, Dr. Kesselman.
Thank you, Dr. Lippman. Thank you for having me.
I will tell you folks that I've known Dr. Kesselman for a long time, and he's one heck of a good guy and a terrific doctor, so thank you.
Thank you. Thank you for having me.
Thank you. And we have Dr. Kiran Sando, Pharm.D. She's the Assistant Dean of the College of Pharmacy at Nova Southeastern University. So welcome.
Thank you. It's good to be here.
Can I call you Kiran?
Yes, you may.
I'll call you Kiran. Dr. Kesselman, talk to me about rheumatoid arthritis.
It's a great topic, Dr. Lippman. In fact, millions and millions of Americans have arthritis, and the incidence of general arthritis is growing in our population. With baby boomers, their risk of osteoarthritis is growing. Rheumatoid arthritis is an autoimmune disease, which means basically that the body is fighting itself. The body produces some particle that's not recognized that it was produced by the body, and then it develops an antibody-antigen response, basically not recognizing that this particle was produced. And then this particle goes on to cause more inflammatory responses throughout the body, and it afflicts generally 1% of the population. We have many more people that have and suffer from osteoarthritis or general arthritis in the population than we do rheumatoid arthritis, but the incidence of general arthritis, whether it's rheumatoid, autoimmune, or general wear and tear arthritis, is growing in our population.
And Dr. Sando, otherwise known as Kiran, since you allow me to call you Kiran, the autoimmune disease issues are an area that you have some significant expertise and knowledge in. So why don't we talk about that?
Sure. So from a perspective of rheumatoid arthritis and some of the medications that we use to treat them, we target specific areas of the immune system. And a lot of the autoimmune disorders that are currently around, we try to calm down that immune system to treat the disease. So some of the agents that we use for rheumatoid arthritis, for example, help to calm down some of the inflammatory signaling and markers that can lead to progression of the disease. So these days, over the last, I'd say 20 years, we've had a huge increase in the number of biologic medications that are available that treat specific areas of the disease with regards to the immune system.
So Dr. Kesselman, as Dr. Sando was saying, the whole field of medicine, not only the area that we're discussing today, is in a race to change. Not that we ever want to leave behind the principles that everyone was trained with, but now all of a sudden we have a major difference in the manner in which we are looking at the functions of the body and the biologic issues that relate to what causes X disease and Y disease, and how do we treat things. And the whole the topic of autoimmune, I would say, treatment for these diseases has become something on the minds of not only our viewers, but it's been written about and talked about throughout all of our media sections. So let's get into it.
It's a great segue. I think what's happening now is there's a whole field of what we call precision medicine. and targeted therapy. So in the earlier days of rheumatology, and rheumatology we've been around for a long time looking at joints and joint diseases, a patient would come in to the office with joint swelling in their hands. And generally rheumatoid arthritis affects the big knuckles and the kind of the smaller knuckles, what they call the MCPs and the PIP joints. They'd come in with swelling of their joints, swelling of the knees, and they wouldn't realize what exactly was going on. And physicians didn't have laboratory tests to order. They didn't have what they call a rheumatoid factor or evaluation of autoantibodies. So we would judge based on criteria, how long they had the swelling, if they had any rashes, if they had any swelling of larger joints or smaller joints, did they have any fever. So we would put together criteria. Now, as you mentioned, as the world of medicine, the field of medicine is expanding on an exponential basis, we're looking at targeted therapy and precision medicine where eventually a patient will come into our office and we'll be able to do a gene analysis and find out what gene was affected and what medicine we can use because of what inflammatory character they have produced. So as far as guessing about which medicine a patient will be able to tolerate, now we're going to eventually have definitive answers as to which medicine they should be on.
So now, Dr. Sando, now we're in your area because, you know, I know that in our College of Pharmacy and in pharmacy in general throughout the nation, education is now has a command by the new knowledge that has come our way to work with the physicians and the other caregivers in healthcare, and they want to use the knowledge that you have. So let's talk about it.
Sure. So there's definitely been a growth in the desire for interprofessional education, because we know that when we go out and work in our various clinical environments, that patients, when we work together as a team, whether it's a pharmacist, physician, nurse practitioner, all of these various folks that we have on the care team, when we work together, it produces better outcomes for the patient. And in these areas where there are genetic factors that affect the treatment of a disease, especially with regards to choosing medicine, a pharmacist is an excellent person to have on that team. So pharmacogenomics is the area that's really growing, where we're targeting specific therapies based on somebody's gene response. So in cardiovascular medicine, there's examples of certain antiplatelet medications that you may get after you have a heart attack or a stroke, that certain patients respond better to certain of those medications based on their genes. And there's simple tests that we can do. And then pharmacists can help interpret that information and then give guidance to the physician or the treatment team about which agent is best. We have some growing research about that in rheumatoid arthritis, although it hasn't quite translated into the clinical setting. And it's an area that I think that's going to continue to grow, and another reason why pharmacists and physicians should continue to work together.
You know, as these folks know, my first profession, before I got into education, was pharmacy. And I say this often, but you know, I always tell the folks that watch us, don't walk into your pharmacy and just walk up and sign that little consult thing and say no consult. When you have the repository of knowledge sitting back there, these are not the people who are just counting tablets or pouring liquids and just, you know, entering numbers. There's these highly skilled, highly trained pharmacy knowledgeable people who are pharmacists. I got to believe that the folks don't realize often what they're giving up when they don't consult with the pharmacist, because you're really consulting with Dr. Kesselman. Mm-hmm. Dr. Kesselman is consulting with you.
Yeah.
True?
The pharmacy profession has evolved a lot over the last 25 to 30 years especially, and now pharmacists are migrating out of the traditional health system hospital basis like you talked about, and moving more into outpatient settings to guide selection monitoring and treatment of disease. So in my clinical practice, I've been involved with primary care for about 10 years, ever since I did my residency training. And I worked alongside physicians to help manage patients with chronic disease, things like high blood pressure, diabetes, and the physicians would often bring me in to consult with difficult cases where they felt like they tried the first couple line therapies and weren't getting a good response. So I would help to manage those patients, and I'm able to follow along with them very closely, and doing so right alongside the physician and advising the patient in that plan of care. So today's pharmacists now all have doctorates. So the entry-level degree for the pharmacy profession is a doctor of pharmacy. So typically they do anywhere from 6 to 8 years of education. And then following pharmacy school can have anywhere from 1 to 2 years of residency. So sometimes doing a general residency first, followed by a specialty residency. And then even more than that, sometimes you can get further training and fellowship, research. So it's really gone along more towards the medical model of training. So the person behind the counter that you interact with, like you're saying, is very well qualified to answer questions. So if you have them, definitely make sure you stop in and chat with your pharmacist.
Well, I've known, like I said, I don't usually personalize my part in this show, but I've known Dr. Kesselman for many, many years, and I know how his functioning medical profession has moved on, because he's never rejected new knowledge. And I'm saying this right in front of you, Dr. Kesselman, because new knowledge is always available, and new knowledge might be differential or different than the old knowledge. And he's always been willing to communicate, because he's very collaborative. I mean, I'm telling this to you in front of him, but that's the way it is. And we're, you know, particularly here at the College of Osteopathic Medicine and our new school, the Kiran Patel College of Osteopathic Medicine, and also the Kiran Patel New College of Allopathic Medicine, which is the MD school, we are going to be collaborative. And the collaborative nature of what we do and what he is teaching students will relate to just what you just said. Because all healthcare givers have to communicate, or else we don't use the knowledge that we have.
Absolutely. And that's, in fact, we were just speaking prior to the taping of trying to form some type of collaboration and interprofessional relationship that there's teaching of rheumatology in other fields on campus, and to try to bring that together. But one of the things that I focused on coming to NSU, being that there's such a wealth and wonderful wealth of talent, is to try to reach out to other colleges to find people in those colleges that are interested in relationships, and try to collaborate with them. And I've made so many wonderful contacts, and developing rheumatology research on campus, which I think is a fantastic part of being of a medical school. And here at the Kiran Patel College of Osteopathic Medicine, we have that tremendous opportunity to interact with so many wonderful other talented healthcare professionals, and to develop rheumatology research, which I think every medical school should start doing. And we're going to be developing that here more and more. Also, as you mentioned, being that I started my career as a cardiologist, having the ability to have all my cardiology training in dealing with patients who have rheumatology diseases, because we know that cardiovascular disease is the #1 cause of mortality and morbidity in our rheumatoid and our rheumatology patients, gives me an extra step up when I evaluate patients, because I'm not only evaluating them from a joint point of view or a connective tissue disease point of view, but also looking at their risk factors and try to modify them, which I think is very, very important.
I really think that the collaborative nature of the Health Professions Division here at Nova Southeastern University is really a wonderment of opportunity for health professionals that are emerging beyond what is called stereotypical, and I don't want to, it's a bad word to use, but that's what it is. You know, you go to school for 4 years, you go to school for 6 years, you go to school for 8 years, and this is what you turn out. But I think healthcare has changed dramatically. It's no longer cookie cutter. It's because there is no cookie cutter. It's the collaborative nature, the interdisciplinary nature of health education that is changing everything.
And,
True?
And I'll just start, but the team approach, as was mentioned, the team approach in taking care of patients, I think, is ideal. A pharmacist together with a physician, with a nutritionist, with a physical therapist, that has to be the goal and the role model that we would aim for. I think the future in rheumatology, there's a big focus on rheumatology wellness, and trying to focus on diet and exercise and the spiritual aspects of healthcare to try to help patients, that we're just not deliverer of medications. We're not just deliverer of surgical therapy, but we want to encompass the whole patient. And we know that our patients are seeking nutritional guidance elsewhere. They're seeking guidance on supplements. They're seeking guidance on all alternative types of medicine. And I think physicians for the future have to be that person, along with pharmacists and nutritionists and physical therapists, to guide our patients, because it's not only medications that are important in a patient's life, not only surgery, it's the complete aspects of medical care.
I see you shaking your head, Dr. Sando.
Well, the therapies that are used for management of rheumatoid arthritis, especially the biologic therapies, can be quite complex. So, they're high-cost medications ranging anywhere from $1,000 to $3,000 a month, sometimes $10,000 annually. They have a lot of requirements for approval through insurance companies. So if the patient has insurance, the patient may have had to fail, one or two other oral medications before they would be granted approval for one of those. So there's a growing area of pharmacy called specialty pharmacy, which has supportive members of the team that are able to navigate those insurance waters, work with the physician's office to get some of the prior authorization paperwork or step therapy paperwork completed, and then provide adherence guidance. So along with supplements, nutrition, taking your medications regularly is such an important part of treatment of any disease. And a pharmacist being involved in the care of the patient can actually help to improve those adherence measures, because we're providing education, not only on how the drug works, but also how to take it most effectively, how to mitigate any side effects or adverse effects with the drug. So that's really a prime area where pharmacists work alongside physicians in the rheumatology space.
Well, let me just say on that for a second, because I know that Dr. Alvarez, who's in charge of our providing oversight of our pharmacy services here, and of course at Nova Southeast University we have a pharmacy in our clinic building, but it's really it's an open pharmacy. In other words, people from the community can use it, as well as with the many thousands of opportunities for services to our employees and students. But MTM,
yes.
Tell the people what MTM is, because that's what you were just talking about.
Sure. So MTM stands for Medication Therapy Management, and it was a benefit that was added to Medicare Part D, which is the drug coverage part of Medicare, where patients that have certain numbers of chronic diseases or have a certain out-of-pocket drug spend are eligible to receive an annual medication therapy management review by a pharmacist. So typically, your insurance company can sometimes provide that service, or sometimes the pharmacy that you go to, like for example, the outpatient pharmacy at NSU, can provide that service. So during a medication therapy management consult, a pharmacist will review the patient's medications with them, go through each medication, make sure that it's being used for its intended purpose. Are you having any side effects with it? How does that interact with the other medications you're taking, or maybe sometimes dietary supplements that we might not always tell our doctors about. So the pharmacist will do that comprehensive review and then provide a set of recommendations, which will then be communicated to the physician. And that's all done, usually on an annual basis, and sometimes more frequently if needed.
Dr. Kesselman, one of your colleagues at the College of Osteopathic Medicine is one of not only America's, probably the world's experts in autoimmune and immunosuppressive diseases, Dr. Nancy Klimas. It would be very interesting to know of your communications with her and how she's going to help and aid in some of the areas relative to treatments.
I've had the pleasure of knowing Dr. Klimas for many years. In fact, when I was practicing cardiology, and I would encounter patients that had chronic fatigue syndrome, looking for an expert was difficult. And I found Dr. Klimas at the University of Miami, and would have a nice relationship by sending my patients down to her when she was available to take patients, because she's heavily involved in research. She's a wonderful, amazing physician, clinician, researcher, and we have a good working relationship, because the field of immunology covers not only what she does in chronic fatigue and Gulf War syndrome, but it also covers all the inflammatory diseases as well. And a lot of our patients that she has share autoimmune diseases that I'm treating as well. So we have a nice referral back and forth, and I'm collaborating actually with several of her colleagues on a research project. One of those research projects is looking at celiac disease and non-celiac gluten sensitivity in its effect on rheumatoid arthritis. So we're every day I'm exploring new opportunities to try to work with her and her colleagues.
Well, I don't often use this word, but we're really blessed to have her as part of our, not only the College of Osteopathic Medicine, but also as part of the collaborative research building composite, and her whole team, which it's the largest research team we have, is about, between the physicians that are presenting as well as the researchers, we have about more than 50 people involved in that. But she is really the world's expert in those areas that you just brought forth.
Absolutely, and some of the same colleagues that I listen to, and I go to conferences. For example, there's a Dr. Len Calabrese, who's the vice chair of rheumatology and immunology at the Cleveland Clinic. When I mentioned NSU, he goes, "Oh, how's Nancy doing?" So she's a world authority.
Yes. We're down to the last 3 minutes of this show, so it goes fast. But I wanted to get back to the MTM, the medical treatment management issues,
Sure.
or therapy issues. I know that we're doing that. We have a group of independent colleges, universities in the state of Florida. Mm-hmm. And we have an insurance product that goes called ICUBA. Mm-hmm. And I know that we're doing the MTM for these schools. You want to just very quickly talk about that?
Sure. So Dr. Alvarez and our NSU Clinic Pharmacy has a contract with ICUBA to provide medication therapy management services to them. So that service is typically phone-based. So we have a call center that's located within the NSU Clinic Pharmacy, where Dr. Alvarez, some of his pharmacists, and we also involve our pharmacy students in it, because it's an excellent learning opportunity, help to provide those medication therapy management services via phone to the patients that are served by ICUBA. And we do some of that work as well within our Department of Pharmacy practice. We partner with accountable care organizations here in South Florida and provide a similar service. So we're really engaged in the medication therapy management front here at NSU. I
wanted to touch on it because ACOs, accountable care organizations, mm-hmm. are that's the immediate future. That's right in front of us, right in front of our eyes. Because there will be the opportunity. I mean, Dr. Kesselman, I know over the years you had no fear to talk to your colleagues and communicate with them, because you can't know everything, you know? Mm-hmm. You can't know everything. But ACOs, I think, are something it's right in front of our eyes. The single medical home theory mm-hmm. is coming about, and that means that everyone that has knowledge in various areas is going to be available for who? The people out there, the viewers. Mm-hmm. And I always tell them to take good care of themselves at the end of the show, and I'll say it now, is because the only way that we can get good health care to them is for them to make sure that they get to their physicians, that they ask questions of the pharmacists. Don't be afraid to ask questions. These people are no different than your doctors. And I know how upset you are. Sometimes you're sitting in the rooms and you're waiting for your appointment, and it's a half hour, 45 minutes late, whatever. But you know what? The patients might be asking questions, no different than you do, folks. So take it upon yourself. It's your knowledge that helps your doctors help you get a better and more successful and healthful life. So we're down to the last minute of this show, so I'm going to say thank you very much to Dr. Kiran Sando, who's the Assistant Dean at College of Pharmacy at Nova Southeastern University. And you mentioned the fact that we have a pharmacy. It's sitting in the clinic building, the ZIF clinic building, and it's open to the public. We're not looking for any, this is not an advertisement, but it is an opportunity often to get everything from nutritional counseling to pharmaceutical information. So if you want to use it, go right ahead and use it. But thank you very much for being here.
Thank
we
you.
appreciate you having you. Dr. Marc Kesselman, what can I tell you? I mean, at one time, he doesn't remember this, I don't think, but one time he was my cardiologist, and I'm going to tell him when after the show. But Dr. Kesselman, we're very proud to have you as the Director of the Division of Rheumatology here at in the Department of Internal Medicine at the Kiran C. Patel College of Osteopathic Medicine. Remember, folks, this is your show. If you have any questions, you have any comments, there's a telephone number and an email address right here. And if you have any other subject matter you want us to talk about, let us know. I always tell you to take good care of yourself. I said that early in the show, but take good care of yourself. Don't put something aside. Get to your healthcare professional. Make them aware of it. You want to live a long and a healthy life? Do it. We haven't even talked about all of the issues of nutrition and exercise and everything, but we'll talk about that next time. So until next time, remember, this show is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.